Rhodes, meet Dr. Bekker.
Ava.
Connor.
I'm sure you two will enjoy working together. I'll leave you two to get acquainted.
He's very odd. Asperger's?
Dr. Latham is a great surgeon, teacher, and friend.
Oh, loyal. That's sweet.
You know what, Dr. Bekker, I'm not sure we will enjoy working together. Thanks. Hey, what are we looking at?
He needs a new valve.
Ava Bekker, CT fellow. Ethan Choi, chief resident of the ED.
So we crack his chest, replace the valve.
Well, we don't need to crack his chest. Mr. Crocker's been assessed as intermediate risk in transcatheter aortic valve replacement. TAVR is now FDA approved for patients at that level.
We get excellent results with open aortic valve replacement. With TAVR, you're just inviting complications.
I don't agree. You know, why put the patient through a long operation and a long pump run? He can have a functional heart again in under 2 hours.
The less invasive, the better.
Exactly.
Excuse me, you're an emergency medicine resident. Why are you even talking?
Excuse you? Because I value Dr. Choi's opinion, and I think you'll find that Dr. Latham will back me on the TAVR.
Fine. So, think we can call today a draw?
Didn't realize we were in a competition.
Oh, come on. You know, you're quite the gossip magnet. Your mother committed suicide, drove your girlfriend crazy, and you murdered your attending, Dr. Downey.
Well, then you better watch yourself, hadn't you?
I like dangerous men.
Carry on. Dr. Bekker, busy day. How are we progressing?
I completed my valve replacement. Triple bypass is being prepped now, and Dr. Rhodes' pulmonary thrombectomy is set for this afternoon.
Robin was discharged this morning. Dr. Rhodes will be here as soon as he gets her settled.
You know, Dr. Latham, I'm thinking my bypass patient is stable. In fact, he could probably use another day or two for his heart to rest.
And?
Pulmonary thrombectomy? That's a difficult procedure. With everything Dr. Rhodes is dealing with today, I could take some of the pressure off and perform his thrombectomy. With your permission, of course.
It's very considerate of you.
We're a team.
Yes, take the thrombectomy. I'm sure Dr. Rhodes will appreciate it.
Yeah, you one-upped me. Heart transplant with a significant size mismatch. That looks good on the CV. Guess you have me to thank taking that thrombectomy off your hands.
Ava, I'm really not in the mood.
Should go home and get some sleep.
I replaced this aortic valve 2 weeks ago.
Any intraoperative difficulties?
None.
Cardiac comorbidities?
Nothing notable, no.
Austin Flint murmur. The valve is leaking.
That's impossible. Maybe you're hearing tricuspid stenosis or subclinical MI.
Is it possible you misoriented the valve? Obstructed one of the leaflets?
No, I remember it very clearly. Surgery went off without a hitch.
We should order an echo.
What? What's wrong?
Aortic insufficiency. The valve is definitely leaking.
But you just replaced it. How could it leak?
I don't know. It doesn't make any sense.
Maybe Dr. Rhodes made a mistake. You look like you need this more than I do.
I'm fine.
Sure. Here's a mace, bags under your eyes. You look great. Don't be so hard on yourself. You work our schedule, then go home to your girlfriend, who's basically your patient too. Something like this was bound to happen.
Really? Is that so?
At least it hasn't affected your sunny disposition. Keep up the good work.
Let's go. Yeah, sure, that's fine. Okay, I love you too. Okay, bye. My apologies.
Everything okay?
Yeah, Robin just couldn't find her keys.
Rough morning. Perhaps I should take over the pre-op?
That will not be necessary. Shall we?
Please.
But I'm not in any pain.
I know that's the danger.
Severe three-vessel disease complicated by...
Heavy calcification and extremely poor targets. Cabbage is still doable, but it will be more challenging than normal.
Indeed. You're a lucky man, Mr. Preston. Keeping fit bought you the time to notice something was wrong.
Yeah. Well, Dr. Rhodes said people with arteries as damaged as mine usually just drop dead.
He's absolutely right.
Not to worry, Ray. We'll take great care of you.
To streamline costs.
He's moving in the wrong direction.
He'll turn around.
Your optimism is enchanting. Reality, though, between the clot, then the bleed, his heart is dying. We should push for a transplant.
We're only a few hours post-op. We are miles away from that discussion.
Normally, yes. But a hit and run just died in surgery. His heart is an HLA match.
But you already tested for compatibility. Ray's not even on the list.
Anything that could go wrong with Ray has. We fix one thing, something else breaks. A heart has fallen into our laps. Let's use it and steal a win.
Is that our priority?
You want his death on your record?
Dr. Bekker, you may have elbowed your way onto Ray's case, but he's still my patient. Transplant's not an option.
Then you're just wasting time because the balloon pump he's on won't hold. He'll max out on presses, but he'll still need to go on VA ECMO. Then it gets invasive. A procedure for a temporary LVAD. When that's not enough, a bigger procedure for a permanent one. You're going to put Ray through months of physical and emotional strain only to get back to exactly where we are right now.
Ray's arteries were bad, not his heart. Now that the vessels are repaired, it will compensate for the clot and the bleed. It'll heal.
No, it won't. And when I'm right, I'll make sure the blame is on you, not me. So how's our patient? Heading for ECMO?
Actually, no. BP's risen and is holding. Vitals have stabilized as well. So I'm going to remove the balloon pump and give his heart back its full load.
What do you want? And I was wrong?
I'm not holding my breath.
Ah, I see our patient is making a turn for the better.
For a moment, there was concern the damage was irreparable. A transplant option presented itself, but upon discussing the visual assessment of the heart during surgery, the decision was made to give it more time to come back on its own. It was a risk, but it appears we made the right choice.
Indeed. Nice work, doctors.
Thank you.
Not here.
That motorcyclist is an HLA match to my patient, Peter. But suddenly, your GCM patient is above him on the transplant list? How did he come in this morning at status 2 and suddenly jump to the highest priority?
It's all about the numbers.
You disappoint me.
That motorcyclist is an HLA match to my patient, Peter. But suddenly, your GCM patient is above him on the transplant at status 2 and suddenly jumped to the highest priority.